Hello, and thank you for watching this educational video about the High Deductible Health Plan 5000, also known as the Hdhp 5000 plan. The Hdhp 5000 plan accesses a PPO network. Your PPO network is listed on the front of your medical ID card. Be sure to check the network status of your medical providers prior to seeking medical care. You may check network status in the following ways. Contact your medical provider and ask them whether they participate in the PPO network that you access. Visit AdvantageHealthPlans.com and choose Find a Doctor or Pharmacy from the quick links on the homepage. Scroll down to the list of provider networks and choose the corresponding network. Or call Advantage Health Plans and speak to a Kempton Care advocate. Remember, accessing a network provider doesn't always guarantee the best price. It is important to note that there are certain providers that are excluded from Advantage Health Plans, regardless of the network participation. A list of these providers can be found at AdvantageHealthPlans.com. Advantage Health Plans provides alternative options to help save you money and make better healthcare purchasing decisions. Many medical services are available through KPP-free, such as orthopedic procedures, diagnostic imaging, general surgeries, urology, ear, nose, and throat, gynecology, oncology, inpatient cardiac testing, bariatric, digestive testing, sleep studies, and more. Since the pricing offered by providers who participate in KPP-free is better than pricing available through the network, your cost, up to your deductible, will be lower. Using KPP-free is as easy as 1, 2, free. Just call Advantage Health Plans to get started. Your cost for laboratory services, up to your deductible, will be lower if you choose to use a laboratory provider that is directly contracted with Advantage Health Plans for enhanced benefits, such as LabCard, Diagnostic Labs of Oklahoma, Quest Diagnostics, Clinical Pathology Laboratories, and more. Visit AdvantageHealthPlans.com for a full list of participating laboratory providers and draw sites. Your cost for some medications will be lower if you choose the Premier Drug tier. We will discuss this further in a moment. Important reminder, under IRS guidelines, with the exception of ACA-mandated preventative services, participants enrolled in a qualified high-deductible health plan must meet their deductible before receiving a 100% benefit. The individual deductible for the Hdhp 5000 plan is $5,000. The family deductible is $10,000. If you have selected employee-only coverage, you must satisfy the employee-only deductible of $5,000 before the plan pays for any benefits other than the preventative services. If you have selected family coverage, the family unit deductible of $10,000 must be satisfied before the plan pays for any benefits other than preventative services. However, if a member of the family unit meets at least $5,000 of the family deductible amount, the plan will pay benefits on that member subject to the plan out-of-pocket requirements. The co-insurance percentage for this plan is 100%. Advantage Health Plans will pay 100% of covered charges after your deductible has been met. Physician's office visits, specialist office visits, and urgent care visits will be applied to your deductible. Your deductible and coinsurance will be applied for all medical services performed in an emergency room. For procedures performed outside of your physician's office, your deductible will be applied. Remember, your cost up to your deductible will be lower if you choose to use KPP-free. Pre-certification of all inpatient confinements, outpatient surgeries, and sleep studies is required. Pre-certification is ultimately your responsibility, even if the medical provider often performs this task. If you are unsure if your medical service requires pre-certification, or if you need to find out if your provider has completed this task, please call and speak to a Kempton Care advocate. Your deductible will be applied for outpatient laboratory services. Your cost for laboratory services up to your deductible will be lower if you choose to use a laboratory provider that is directly contracted with Advantage Health Plans for enhanced benefits. After you meet your deductible, Advantage Health Plans will pay 100% of covered charges for diagnostic imaging services. Your cost up to your deductible will be lower if you choose to use KPP-free. All charges for inpatient hospitalization are subject to your deductible. Your prescription benefit plan through Advantage Health Plans is administered by Southern Scripts. It is important to remember that the use of a participating in-network pharmacy is mandatory. Prescriptions filled at an out-of-network pharmacy will not be covered. Check AdvantageHealthPlans.com for a list of excluded pharmacies. For prescription medications, after your deductible is met, the plan will pay 100% for both generic and for name brand medications. A 102-day supply of covered maintenance medications is available at your pharmacy or by mail order. There are specific high-cost name brand prescriptions that have a lower-cost therapeutic alternative. Please review the medications included on the therapeutic alternative drug list and the cost-saving alternatives available. A drug will not be included on this list unless it has a lower-cost therapeutic alternative. Your cost up to your deductible will be lower if you choose a therapeutic alternative. This list is available at AdvantageHealthPlans.com. Your cost for some medications will be lower if you choose the Premier drug tier. We will discuss this further in a moment. Specialty medications are exceptionally expensive prescriptions used to treat complex chronic conditions like cancer, rheumatoid arthritis, and multiple sclerosis. These medications often require additional medical management and oversight. Specialty medications are subject to your deductible and must be obtained through the Southern Script Specialty Pharmacy. For assistance with your out-of-pocket costs for some medications, please contact Advantage Health Plans and speak to a Kempton Care advocate. Be on the lookout for communications from Script to Savings. These communications may come via email, text message, or snail mail. If you receive a communication from Script to Savings, it will include information about how you can save on your prescription medication costs. This plan does not have a benefit differential when utilizing an out-of-network provider for medical services. You are free to use the provider of your choice. However, all out-of-network claims will be processed at the maximum allowable charge, which is often a percentage above the provider's current Medicare rate. If no Medicare rate is available for a particular service or provider, another reference will be used. Physician's charges are processed at the provider's Medicare rate plus an additional 30%. Facility/hospital charges are processed at the provider's Medicare rate plus an additional 60%. Anesthesia charges are processed at the provider's Medicare rate plus an additional 150%. Outpatient laboratory charges are processed at 100% of the provider's Medicare rate. Emergency charges are processed at the provider's Medicare rate plus an additional 100%. Air ambulance charges are processed at the provider's Medicare rate plus an additional 20%. Advantage Health Plans has a partner that offers a robust patient advocacy program. If you need assistance speaking with an out-of-network physician or facility about whether they will accept the plan's reimbursement, pre-service advocacy is available. A team can assist you in finding a provider that has agreed to accept the plan's allowable reimbursement. If a balanced billing situation does occur, there is a comprehensive patient advocacy process in place to assist you. Call and speak with a Kempton Care advocate to learn more or to get assistance with a balanced bill. Additional information about your benefits, including a summary of benefits and coverage, and your summary plan description, are available by visiting AdvantageHealthPlans.com and logging into the member portal. If you have questions about your benefits, please call 800-324-9396 to speak with a Kempton Care advocate. They are available Monday through Friday, 8 a.m. to 5 p.m. Central Standard Time. Thank you for listening to this explanation of the Hdhp 5000 plan, and thank you for being a participant in Advantage Health Plans.